Distinguished guests, ladies and gentlemen, I am honored to have been invited to address you all, and I regret that I cannot be with you in person today. As a mother myself, I'm convinced that improving the lives of mothers and their children is the most uniting global issue, central to humanity and the future of our society. The harsh reality of avoidable maternal and newborn mortality and morbidity is hard to accept in the 21st century. Each day in Kenya, 15 women die due to pregnancy-related complications. This translates to over 5,500 deaths annually. At the same time, over 100,000 infants die every year. These figures are a tragedy and are unacceptable given that they are preventable. They also urge us on to continue the fight until these kinds of deaths are banished from our world. This is why a conference like this is so important. In order to face up to the challenges of reaching each and every woman and child, we must document what we have done that has been successful, and we must decide what needs to be done differently. For this, we need data, we need analysis, we need research. We also need to ensure that we involve our citizens to ask them about what they want and what would make a difference in their lives. A country's health system is planned centrally, but I firmly believe that health itself is local. It is the environment in which you live. It is neighbors taking care of one another. It involves the family, the village, local leaders, and the whole community. If people and communities feel involved and responsible for finding solutions for their problems, then these solutions will be far more effective and sustainable. I'm very glad to see that as well as talking about new research and new innovations that will take us into the future of care for mothers and children, you will also be discussing the implementation of research results. In Kenya, we are working at the frontier of delivery of health innovations at community level. Kenya is utilizing many different e-health technologies since 80% of our population has access to a mobile phone. These innovations vary from e-learning to rapid SMS technology, which reduces the time lag between testing and giving results. We are also using mobile telephony to track births and deaths in collaboration with the Department of Civil Registration. In addition, there are several mHealth innovations aimed at improving access to health information. The system converts maternal and child health data into an electronic version. This allows the health worker to track the progress of clients' data and send SMS and voice messages along with appointment reminders to their mobile phones. At the start of 2014, I launched the Beyond Zero campaign, distributing mobile clinics throughout Kenya to deliver health services and information to our citizens where they live. These clinics are an important step in the process of bringing health to the people and adapting solutions to suit communities' particular environments and lifestyles, especially within nomadic areas. Ladies and gentlemen, we need new answers, new ways of doing things to reach those that we have not yet reached. We need people to advocate for change, to speak for those whose voices are not loud enough on their own. I'm very much looking forward to hearing the outcomes of this conference and to the recommendations of so many experts that are assembled in Brussels today. Finally, We also need countries and regions to work together. For this reason, I would like to thank the European Union for organizing this conference and for creating a platform to discuss how research and innovation will play a role to achieve the new Sustainable Development Goals. I thank you and wish you fruitful deliberations.